Hi, I'm Dr. Adonis with Living Well Integrative Health in Northfield, New Jersey. Today we're going to go over 2 things that I give my patients to help them retain and regain their shoulder health. So we'll help you if any prevent shoulder injuries as well as to get back your mobility, your overhead mobility of your shoulder. Okay, using these 4 pieces of equipment. We got the Theracane, a softball, a lacrosse ball, and of course a Theragun. Okay, so the first movement that we're going to go over, the first active recovery technique, is going to be self-massage of the subscap. Okay, so the first way we're going to do it is we're going to use this. So the subscap is a muscle that's in front of your scapula in the back of your armpit, between your lat and your pec. So what you're going to do is you're going to use this device. You're going to place this right in the back part of your armpit, and you're going to hold the big hook part as if you're doing a headlock while gripping the small hook. And then what you're going to do is you're going to pull the hook in with the inside part of your elbow while twisting. And what this is going to do, it's going to get that muscle that's right in front of your scapula or your wing bone that tends to get tight and overused when you have tight shoulders. Okay? You're going to utilize this for about 20 to 30 seconds. Okay? Now actually loosen up your shoulders so you can hold your elbows extended overhead. Okay? So we're going to start the door jam. And I like this nub because it keeps the softball in place. You're going to place the ball, once again, in the back part of your armpit, in front of the lat, but behind the chest or the pec. So you're going to start with your thumb facing your mouth, like as if you're sucking your thumb. And then what you're going to do is you're going to lean into it while holding the softball. You're going to raise your hand and rotate your thumb from facing you to forward, while pulling yourself in onto the ball. When you hit that spot, when the lat flares out, you're going to do like a little circle-like motion. I'm going to repeat that from the opposite view so you can see me pull myself into the wall with the door jam. So once again, I'm here. I'm going to rotate out here. Okay, and I'm going to pull myself in while doing a circle-like motion. Now release the subscap muscle that tends to pull your shoulders forward and lock your mobility up from going overhead. Okay, so using the Theracane and the door jam is level 1. Level 2, for more experienced people, but a little bit more painful, you can go down on the ground, placing the ball in the same location towards the back part of your armpit, in front of the lat and behind the pec. Your thumb is going to be facing your mouth. And there's 2 ways to do this. The first one, if your hips on the ground. The second way, if your hips above the ground. And the second way is a little bit more intense. Okay? So basically, you're going to extend your arm and rotate your thumb toward the ground while doing a circle-like motion. And if you want to kick it up a notch, intensity-wise, get your hips up. Oh, God. And you'll do 3 pass-throughs and holding that top part for about 5 to 10 seconds, releasing that muscle. And you should see that you'll have more mobility overhead, and that should stop the shoulder pain that most people get in front of the shoulder and in the back there. Okay? Moving right along, the second movement that we use, we'll use the ball, is we're going to release the pec minor and pec major. The pec minor is the part of your chest muscle that helps form the top part of your armpit that attaches to your shoulder right here. Okay? Your pec major is the meaty part that's right above your nipple. Okay? So we're going to take a softball and we'll start the pec minor, which is the closest to your armpit, attached to your shoulder, and you're going to put the palm down on the ball, and you're just gonna do a circle-like motion in both the pec minor and then the pec major. That's level 1. Level 2, you're gonna place the ball once again in the door jam, and you're gonna pull yourself into the door jam while doing a circle-like motion on the pec minor, which is on the more outside part of your shoulder, which connects to your shoulder joint, and in the meaty part right above your nipple. If you want to kick it up a notch, get a little bit more spicier, what you're going to do is you're going to point your thumb down and have your shoulder go through the complete range of motion. Starting with thumb forward, going all the way back to your elbows are behind your ear. As well as you'll start midway through the motion with your thumb pointing down and opening it up so it points behind you. Okay? Just do a couple pass-throughs for 3 to 5 seconds. And what that'll do is that'll release this front or anterior part of the shoulder, allowing you to hold your shoulders backward, helping you be able to hold your arms above your head or complete a pull-up or a press above the head. Okay? The second tool that you can use for that is a massage gun. Pretty easy. Once again, you're going to start the pec minor, which is closer to the shoulder joint. Make sure that your gun is charged completely. You're just going to hold it for like 10 to 20 seconds each spot. Pec minor, pec major. And that's basically it. So remember, being weak and in pain is a choice. See you on the other side.